Hey, Dr. Michelle Wolford here. I want to talk to you about remedies. So, I think that this is really important because I want to share with you some of the remedies I use in my practice and my approach to supporting patients. But more so, I want to talk specifically about COVID-19 because I know that's what's on everybody's brain and supplements or remedies or natural approaches to supporting COVID. This is a very young virus. It's 2.5 months old. So most of what I'm going to say has not specifically been tested on COVID-19. So it's more theoretical, but under the umbrella of other COVID viruses, we are making some sort of theoretical thoughts that this virus will respond similarly to other COVID type, coronaviruses out there. So I just want you to know that this is more theoretical because everybody's working science-wise to figure out what is actual factual information and moving from the hypothesis and the theoretical. There was actually a study published on March 20th, 2020, so I will get that to you at the end of this. Unfortunately, there's a lot more money available to testing Western medicine drugs versus natural medicine drugs, which is the unfortunate piece because we'll probably hear more of that than the natural alternatives. But I definitely want to speak to you from a scientific perspective on the natural remedies that could support a viral infection. And again, it would be theoretical for COVID-19 specifically because it's so young and it's in its infancy, but it is actually scientifically factual for other viruses. I also think this is really important because there are people that I know out of the goodness of their heart are just saying, take this, take that, and they're telling their friends and they're telling their families. But I actually recommend that you seek out professional advice because there are nuances to the COVID-19 virus and the different receptor sites that it attacks and when and why. And so to just hear everything I have to say here today and go out and buy it all, I think would be a mistake. Or because I'm not treating you specifically, I'm just talking to you about different remedies that are supported from a naturopathic perspective. For you to see an ad on Facebook or hear your friends say, take this or that, I also would highly just move you against doing that without any true advice. And you'll hear why I'm saying that in this talk, because one of the things that we're looking at is your body will go through, so for example, and we'll talk more about this in the immunology portion, but when a virus comes into contact with a body, a human cell, there's a natural response that's supposed to happen, and that activates the natural killer cells and the CD8 cells, and we want that response to be able to mount itself. Once the body feels that the virus is under control and that the infection is under control, and the natural killer cells and the CD8 cells have already taken care of the infected human cells, it then ends up mounting a Treg cell. So they're regulators. They basically say, okay, you can slow down. We got this under control. And so the people that are having the biggest issue with COVID-19 that are moving into the scarier subset, which is what we're hearing most of. So this doesn't happen to everybody, right? So our media is focusing on a subset of the population that is having the more deathly and scary side effects and symptoms. And they're scaring us into submission, I feel. But what's happening is these people are moving into a cytotoxic storm. So it's when those Treg cells are not able to actually say, hey, regulate yourself. Don't be so active. I need you to downregulate here so that the immune system's not running on overload. And so these aren't kicking in for these particular people. And so they end up moving into a cytotoxic storm because they're clicking off a lot of inflammatory markers, and it can end up toxifying or damaging the body. And yes, worst case scenario is it could move you to death. And so I do think it's important because, for example, and we'll again get into this in the immunology, is we have Th1, Th2, so we have these immune responses and they're supposed to turn on and off at particular times. So to overload yourself on certain natural supplements, thinking, from fear-based, right? Thinking, okay, I got to take care of myself and I can't get sick because the media tells me I'm going to die. You could actually be changing the natural threshold that you should be living at and in regards to your immune system function. And so I do think that there are certain things that you can take as preventative measures, but there are other things that you want to wait to see what happens to your body and if you think you've contracted something. So the whole American adage of more is wrong. Like less is more. Like this whole yes, I was going to say the Costco version. That's what we used to call it is no offense to Costco, but just having more and consuming more isn't always of benefit. So the two biggest concerns with COVID-19 is that it's attacking the ACE2 receptor sites, which again, we'll talk about in the immunology video. And then again, stimulating the overproduction of interleukin-1 beta, which is equating to the cytotoxic storm. So what I want to focus on in this particular talk is what different herbal remedies can be supportive to this particular virus. And again, some of this is in theory because it's helpful for other corona type viruses or other viruses in general. So we are theoretically alluding to the fact that it could potentially be helpful. And then I also want to be able to talk about why it is so important to have that baseline of health. And right now, this is a great opportunity for you to be thinking about how you can support your baseline of health, because there are preventative things that you could do, coronavirus or not, that is actually going to be protecting a huge portion of this population because they've already put some of these immunitive, supportive, body balancing mechanisms into action before corona even existed. And so maybe I can then highlight why that is of such value and why things like probiotics isn't some marketing scheme or, some fad, but it actually has true value. Okay, so we know that for an average immune system response that we want a Th1 T cell response. So this is what I was speaking to earlier. So that means virus comes into contact with the body and it ends up releasing natural killer cells, CD8 cells. They go after the infected viral cells, the human infected viral cells. We mount a response, which usually equates to some sort of sign or symptom that your body is protecting you, that your body is saying, yo, dude, can you see? I'm actually helping you out. So why we want to suppress fever? Doesn't make sense to me. You don't want to suppress a fever. Why are we so afraid of having signs or symptoms? I don't know. Let your body talk to you. Listen to what your body has to say. And so then once the body feels like all of that's under control, the Tregs are going to kick in, and that's going to regulate your immune system function. It's going to down-regulate it so it doesn't have to fight as hard. Okay, so things that support the Th1 cells early in disease, so early in the expression, what we've seen historically speaking is going to be antiviral herbs. And some of those antiviral herbs are things like astragalus, golden seal, elderberry, echinacea, Oregon grape. So these are all antivirals and they can be helpful. And so again, if you feel like you're in those early stages, this is a prime opportunity to connect in with your naturopathic medical doctor so that they can support you. Because currently, well, up until March 20th of 2020, there was no Western medication option out there. We did start to hear that there were some options. Chloroquine, which is known as a malaria drug, has been very helpful. And that in combination in IV with azithromycin has shown to be very impactful. And in a study of 20 out of 20 people, they saw 100%, what's the word I'm looking for? Not heal rate, but excuse me. Not remission either. My brain's moving so fast. We saw that these people were able to recover from coronavirus within 6 days. So rumor has it, and I don't like to spread rumors, but now it's hard for doctors to get this anti-malarial drug, so I haven't fully looked that up, but that's interesting, right? That something that would work and help heal people is actually maybe not available anymore. Okay, so other important vitamins and minerals, vitamin A, vitamin D, vitamin C, we talk about these things. There is a lot of value to that. So being sure that you're getting adequate amounts of these nutrients in is extremely important. And being out in the sun, breathing fresh air. So this is also important. Move your body, breathe fresh air, get outside. Vitamin C, so the reactive oxygen species, vitamin C helps with that. So we know that it can reduce the specific inflammasome that is within this disease that we're seeing with COVID-19. Um, and so I've just been telling most of my patients like 2,000 milligrams of vitamin C as preventative. And then if for some reason you turn out positive, I would say 5,000 to 10,000 milligrams of vitamin C per day. And that would be an adult. So it would probably be different for kids. But this also brings up a very interesting topic of conversation. I was listening to a lecture that Dr. Heather Zwicky, who was my immunology professor in school, and she also used to work, I believe, for the CDC. I've got to look that back up. Her actual, I guess, medical credentialing. But she was an immunologist and an integrative health expert. I know that she trained in infectious disease. She has her PhD in immunology and microbiology. She was my professor. For many years, she worked on the vaccine technology for tuberculosis. And again, I think it was the CDC that she was working with, but I would have to confirm that. But she's an incredible immunologist, and I've been listening to some of what she's been sharing with us about COVID-19 to make sure, again, that I have the most factual and up-to-date and real information for you, not media-based, fear-based, go hide in your home and freak out that you can't step outside because the boogeyman's going to get you information, but information about how this virus attacks certain cells, who's truly at risk, and who's maybe at a lesser risk, and what that manifestation is. And then, again, just want to be very clear, theoretical remedies that may support COVID-19 based upon how these particular plants have supported other viruses, including other corona-type viruses. So something that she had shared, which I thought was really fascinating, was the reason that kids are not getting or contracting or having as crazy as side effects of the corona as adults is because of the amount of melatonin. So she was actually speaking a lot about how that's an inverse relationship, meaning the greater the melatonin, the less risk or exacerbation of the virus. It doesn't appear that to date there's any affirmative studies that show that exogenous, meaning I take it in supplement form and put it in my body, forms of melatonin is actually antiviral or supportive to somebody who has contracted COVID. And I don't even know how supportive it would be if you are in a healthy state. But what I can tell you is regulating your sleep and working on your sleep hygiene is huge. So we've talked about this for years, for probably centuries. I don't know, I haven't been around that long, but we've talked about how important sleep hygiene is. And more so than ever, I'm telling you how important sleep hygiene is. To get yourself on a routine schedule of getting up at a certain time and going to bed at a certain time for you and for your kids, and being able to get good, strong, adequate sleep. Reducing stress is important. We hear this a lot, but it kind of, I think, blows in one ear and out the other because so many people are always talking about, oh, reduce your stress and this and that, da, da, da. And it's just, we don't hear it anymore. But this is important to know. Stress increases IL-6, interleukin-6. This is an inflammatory marker. As a matter of fact, anxiety and catastrophizing is known to increase IL-6, which is also known to make this particular virus worse. So there's a lot of science behind this. Okay, so reducing stress is extremely important. And so meditation is an excellent way to really decompress, to get back into your body, lower your cortisol response, stop shooting off so many inflammatory markers. If you're having a lot of inflammatory thoughts, right? You're angry, you're frustrated, you're hyper emotional. That is going to create a lot of inflammation in your system, which means you have higher interleukin-6, which means that if you are exposed to corona, then there's a chance that it would have a little bit more fun with your body. It's going to wreak a little bit more havoc. And so reducing stress, again, whether that's walking, exercising, whether that's deep breathing, whether that's meditation, sleep routine, just closing your eyes for a couple of minutes, all of that is super important. So there have actually been some herbs that we have found that decrease interleukin-6. And some of those herbs are rosmarinic acid and lemon balm, passiflora, ashwagandha, feverfew. So again, please don't go out and just go buy all of this stuff out of fear. One, I don't think it's fair to the community or to the environment. But two, I just don't think that you necessarily need it all. It's great to know that if somebody is in a crisis, you can come to your doctor or you can stop by the grocery store and you could have it. And maybe you want to keep a bottle of one thing on hand just so that you can get it the moment that it arises. But these things that I just mentioned, these plants, because I do believe that anything that the world creates always creates an antidote for healing, which is why I love natural medicine. And I really believe in it, and I've seen amazing things for all of my patients, and I have patients around the world. So it's like not specific to a part of the world or a gender or to a race or to an age or so forth. Natural medicine is extremely powerful and wise. So those are some herbs that can lower interleukin 6. This also particular inflammatome that we talked about for COVID-19, it stimulates MLRP3. You don't need to worry about all those kind of things. But what we've learned is there are additional therapies that could be effective for reducing the MLRP3. Melatonin is one of those. Vitamin C has been known to reduce MLRP3, and again, rosmarinic acid and lemon balm. So there's a lot that we can do with natural medicine, and I'm just like so excited about that. I'm so excited to share that. Again, if you have access to being able to get an IV of high dose vitamin C's, I think that could be very beneficial. And then things like if you're going to go the Western med route and you can find it, chloroquine, again, the anti-malarial drug, has shown to be very helpful with azithromycin. And so that was the case study I had mentioned earlier. Let me think if there's anything else that I wanted to add in. Oh yeah, I wanted to actually share with you about other herbs that have been known to lower NF-kappa beta cells. So those they're activator, they prevent against inflammation. And so we've heard over the years like curcumin, it can be so helpful for like joint pain and inflammation. And I'm on the fence of this one because I also did a lecture with Dr. Walsh, who was pretty amazing when we were talking about how to read labs in a different way. And I remember him sharing about how that actually blocks a phase 3 detoxification. So most of these herbs that I use, I don't have my patients on for life. Like our Western mentality has been go to the doctor and you see something's wrong and you take a pill and you go home and you're on that for life. And there's never conversation. I shouldn't use the word never. It seems that there's not usually a lot of conversation around dietary changes and mental, emotionally, what's happening in your life, and meditation and exercise and movement, and understanding what's happening with other organ systems that could be exacerbating why this particular weaker organ system is showing itself the way that it is. And so to take the mindset of this, just prescribe a pill to make a symptom go away, and to use that in natural medicine is still not practicing medicine in my idea. That's green allopathy. That's still just picking a natural supplement for an expression. And there may be a time and a place for that, but ultimately there's so much value in really getting to that root cause. And I apologize because I feel like I'm skipping around here. I have a lot of information in my brain and a lot of excitement and a lot of things that I want to share with you. And I am going to take a brief pause on the curcumin and kind of sidewind you back to the comment I made earlier with the digestive tract and the microbiome, and again, why keeping our system in place is so important. And that is because also having a good, healthy gut flora actually lowers our interleukin 6 response, which is that inflammatory response. And so I'm about to run you through another subset of herbs that for the most part we're focusing on. These herbs have been found to inhibit the NF-kappa beta cells. So we're talking about reducing inflammation and making sure we have the appropriate Th1, Th2 response in the system. And there's there's a balance that we're trying to restore, right? Natural medicine is about restoring balance. It's about restoring that homeodynamic balance inside of you. So not homeostasis. Stasis means still, but this is dynamic because life is ever changing and you're ever changing. And your symptoms and your circumstances and what you come into contact with is ever changing. So how can I strengthen your internal environment, your internal microbiome, your internal spiritual body, emotional, physical, like every aspect of you, so that you are prepared to face anything that you come into contact with, and not to be afraid of it, but to be able to be kind of like that trampoline where the hit comes in and it kind of absorbs it and then it pushes it out. Like that would be a good ebb and flow with life and people and everything. It's to give you a human example, you could be at the office and you could be like, oh, I hate that person and blah, blah, blah. And it's like, and then you shut your door so they never come in and you create all these barricades. But that's not evolution. Evolution is sitting down with that person and like working through what this is. And that applies for everything, your intimate relationships, your work relationships, your business relationships. Like, when did disagreeing with somebody have to be such a big fight? Like, why not have a conversation about different people's perspectives? And then the same thing with the virus. Like, when did we get so afraid that we're locking ourselves in our home? Like, this thing is just going to come in and murder us in the middle of the night. And it's like, we are exposed to bugs all the time, and it is a human evolution. And, of course, my heart, like, I have a subset of my population that they are a high risk, category, and I am keeping a close eye on them, and I am giving them a lot of advice, and I am supporting them. But at the same time, like, I don't know. I also feel like there's just a lot of fear-based information floating out there. So power of knowledge here. So curcumin, quercetin, boswellia, lomatium. These are some great herbs that I use to help lower that interleukin-6. Lomatium actually is a Native American traditional root plant, and it was claimed to have prevented the Washoe, I can't remember the name of the Indian tribe, Washoe, somebody I'm sure will comment on this, from dying in the 1918 influenza pandemic, so also known as the Spanish flu. And in SARS, helping to prevent against like sepsis and inflammatory cytokines and the pneumonia-like symptoms. So again, all theoretical for COVID-19 because everything is so new. But we've seen these plants work historically for centuries, for hundreds and thousands of years. And that's why it's been around for so long. So anyways, I really wanted to touch on the remedies that are available. And I know I did a lot of fast talking here. So, just brief recap is vitamin C, vitamin D, maybe taking very low doses of an antiviral. So those would be things like elderberry, echinacea, maybe even something like astragalus or golden seal. And again, low doses because we want to be able to mount an appropriate response if we come into contact with the virus. Vitamin C, I'm really loving 2,000 milligrams as an adult dose. So I would say 100 plus pounds. And vitamin D, maybe 2,000 to 5,000 IUs. But again, it depends on your past medical history, because if you have vitamin D levels over 70, I would tell you to stop taking vitamin D, because science has shown us that too high of vitamin D can actually calcify some of the lipids in your arteries and can predispose you to cardiovascular issues. So I'm sharing with you the polarity here, because this is why I think it's so important that, one, we take ownership of our health, but two, we don't think that we know everything because somebody posted something that isn't doing the research or doesn't have the background medical knowledge and is just like, yeah, this is great. And so as much as I love the enthusiasm, because I think that that's so powerful and it's just so exciting to see that people are open-minded to utilizing what nature gave us from a healing perspective. Again, it's not the like more is better, mentality. It's there's, taking this in to let the body utilize that is good. More is not better. And sometimes less is actually more. Sometimes less is better. So, and then of course, we are also hearing that kind of the first signs of COVID before the fever and the cough is maybe this this something, in this throat region. So propolis spray is a great throat spray, and HOCl is great to be able to put in the eyes or in the nose or sprayed in the air and inhale it in. I did that the other day. Let me see, do I have it here? It was like colloidal silver, and it had a little bit of tea tree in it. And I was like, you know what? I'm just going to breathe it in here, just give my little mucous membranes a little refreshing dose. So I hope that you found that really powerful and interesting. And I'm just going to finish off with the remedy portion of this talk, really sharing with you some of my approaches. This is less COVID specific, although I will tell you, I use these drainage remedies to support fevers and to help regulate it, meaning if they need to upregulate a fever, like spike a better one, or downregulate a fever, so maybe not be so high. I use a lot of these combination plant-based medicine and homeopathics to really regulate what the body is trying to do, right? And so those have been extremely powerful in any type of sickness that I've had in my practice in both acute and adult patients. And it's really great because when you mount a fever and your body starts killing these bugs, sometimes the body has a hard time kind of sweeping away the residue, right? Like everything, the aftermath, right, of the war internally. And so a lot of these combination plant-based medicine and homeopathics really teach the liver and the kidney and the lymphatic system how to break it down and move it out, which really supports some of the achiness and the pains that we oftentimes feel. Sometimes I add in magnesium because magnesium gets utilized a lot during times of infection. Same thing with copper, same thing with zinc, manganese. So I utilize a lot of those kind of micronutrients as well. And I utilize them in these little, like, again, not the like take the highest dose possible, but in these like little ampules, and you'd be surprised that one of these little vials, like 1 to 2 times a day, can be so powerful. But I've seen it over and over and over again, and I'm just always so excited, to see how well it works. I do a lot in liquid form, so I use a lot of tincture-based stuff because I think it's easily absorbable. You can add it to water. It's less dehydrating to the system, meaning sometimes when something's in a pill in a condensed form, the body brings all of the water to help break it down and soak it up and then shoot it back out into the system. So I find liquids to be very powerful. And believe it or not, homeopathics, like just straight up homeopathics, can be extremely powerful. I mean, I've used homeopathics for dengue fever. I've used it for, anything really. So whether it's stress, anxiety, whether it's nausea, vomiting, hemorrhoids, but they're just these little pellets, and it's the energetic signature of what's happening in the body. And I'm sorry, my brain just reminded me of when there was a study done with a group of naturopathic doctors out of Connecticut, and they actually did vaccine prophylaxis with these homeopathic remedies, and then they took blood tests, and they showed that the antibody response, similar to giving a physical vaccine, actually showed up in these kids' blood work. And so it was really amazing because it was doing exactly what you would want a vaccine to do without having to put in all of those heavy metals and putting in a potentially live attenuated virus or a dead virus and all of the milieu that comes in with that. But they were actually able to see an antibody response with just using the homeopathic, the energetic signature of certain, of measles, mumps, rubella, diphtheria, pertussis, things like that. So it was still giving the body the knowledge and the information that it needed to know how to create an appropriate immune response. So there's a lot of amazing things that you can do naturally. And I think right now, more so than ever, we're learning how important it is to have a clean body, right? If you have not heard anything other than this today, it's that inflammation is allowing COVID-19 to do its thing. And so if you want to be able to be the master of your body and not get sick, reduce your inflammation, reduce your stress, start taking care of your body, take care of your gut microbiome because that has a similar histology to your lung tissue. So take care of your lung tissue, so your mucous membranes as a whole. And it's about body balance. So a lot of these remedies are really amazing, and I don't want to talk too much here, but pill form, powder form, liquid form, of course, make sure it's great, high quality. Please do not hoard. There's a lot of people in the world, and but just take this as information for your pocket, and also know that, again, theoretically, there are things that we could do to support you with COVID-19. I would say my patient population seems to be in really great shape. So I can definitely say it's a testament to what it's done to support their immune system functions. And we are hopeful and excited that at some point there will be some funding for the natural medicines with COVID-19. And I know that we're just at the beginning stages of doing testing for the Western options as well. And so, like I said, I think it was the 19th or the 20th of March 2020 that they actually released their finding about, about chloroquine, excuse me. And then China has also been telling all of their peeps 2,000 milligrams of vitamin C. So there's been some studies over there as well. So hopefully that gives you a good brief COVID-19 remedy talk and update. And I know that was a lot of information, but I hope that you found it valuable.